Hello, my name is Huang Bingol, and I'm currently a senior at UTSA majoring in biology. I am also a proud Vietnamese pre-med student graduating this year, and I'm working toward my dream of becoming a physician. Today, I am excited to share my project over improving healthcare access for the Vietnamese community in San Antonio. This project is deeply personal to me, not just because of my academic background or career goals, but because of my lived experience as both a first generation Vietnamese American and a volunteer medical interpreter. Over the past few years, I've had the opportunity to serve as a Vietnamese interpreter at local clinics. During that time, I witnessed how difficult and overwhelming the U.S. healthcare system can be for people who don't speak the language fluently or who are unfamiliar with the Western medical norms. I saw elderly patients confused about their diagnosis, and I saw family hesitate to ask questions, and I also saw people walk away without fully understanding their treatment plan, all because of the communication barriers, cultural misunderstanding, and the fear of cost. These moments stay with me. They made me realize that becoming a physician is about more than treating illness. It's about bridging gaps, building trust, and making sure every patient feels seen and heard no matter their background. That led me to design this project. To better understand the needs of local Vietnamese community, I conducted a survey. The top reported barriers to healthcare were language, where 6 participants reported. 6 also reported from financial difficulty, and 4 from cultural differences, and a few mentioned other concerns such as lack of insurance or fear of judgment. I also interviewed Vietnamese families, elders, and community leaders. I consulted public health study on Asian American immigrant population. It was clear there's a major gaps in access and the current system isn't working for everyone. That's where this project comes in. It's a 6-month intervention that will provide: number 1, interpreter services by recruiting and training bilingual volunteers from the Vietnamese community. Second, culturally relevant health education workshops hosted in trusted community spaces like temples and churches. Third, the financial assistance for low-income families to help cover out-of-pocket costs such as prescription co-pays or transportation. We're collaborating with the local hospitals, clinic, nonprofits, and cultural centers to ensure that these efforts are well-aligned, inclusive, and sustainable. The timeline is broken into 3 phases. Phase 1 is from month 1 to 2, community needs assessment and partnership building. Phase 2, which is between month 3 and 4, interpreter recruitment and workshop development. Phase 3 is between the 5th and the 6th month, service delivery and program evaluation. Our budget of $7,500 will cover interpreter stipends, workshop supply, and the patient assistance fund. These initiatives fall under the SPICE service learning category because it isn't just about service, it's about reflecting on what we learned through service and connecting it to a larger system and personal growth. As someone pursuing medicine, I see this as a vital training in compassionate and community-centered care. It also reflects HERB's value of the honors core. H stands for honor by listening to and advocating for underserved voices. E stands for equity by directly addressing systemic disparity in healthcare. R stands for resilience by confronting complex challenges through collaboration. B stands for benevolence in serving not just a student, but as a community as a whole. And S stands for support through uplifting both patient and partners in care. As a Vietnamese pre-med student, this work reflects my core values. I developed skills in project management, intercultural communication, ethical reasoning, and public health planning. But more importantly, it's helped me better understanding the kind of physician I want to become. Someone who sees beyond the diagnosis, who builds bridges across barriers, and who uses their platform to serve. I also see this as an opportunity to represent UTSA, a university that has supported my growth and inspired me to turn my passion into purpose. I'm proud to showcase the impact that UTSA students can have when we engage with our community and apply our education to real-world challenges. Through this project, I hope to carry the university values of service, inclusion, and innovation forward in everything I do. Long-term, my vision is to make this model sustainable and its value so that it can be adapted for other immigrant and refugee population across Texas and beyond. Thank you so much for watching my presentation.